I'm Professor Refila Masekela. I'm the academic head of the Pediatrics department here at the University of KwaZulu-Natal. Our Pediatrics department is one of the largest departments in the School of Clinical Medicine, with a large training platform. Our training platform expands from Durban, where we have a complement of 6 regional hospitals, as well as Nkosi Albert Lutuli Quaternary Hospital and King Edward Tertiary Hospital. We also have a training platform in the Pietermaritzburg complex, including Grays, Edendale, as well as Northdale Hospital. We also have in the north, Queen Nandi Regional Hospital, General Justice Gizenga Mpanza Hospital, also in the north, as well as Newcastle Regional Hospital. We train a large number of pediatric trainees with over 40 pediatric registrars in our training platform, and we also have a very large subspecialist training platform as well. In terms of teaching and learning, I'm very proud to say that the Department of Pediatrics has received a number of awards for being the best department in terms of teaching for the undergraduate trainees, and this was awarded in 2020, 2021, and 2023. One of my proudest moments in terms of teaching is I am the director of the Pan-African Thoracic Society MECO training program, which trains people in lung health research, and we've trained over 400 people from over 24 countries across the African continent.
I'm Dr. Lawrence Mabaiwa. I'm a pediatrician, a pediatric neurologist, and the head of pediatric neurology of the Department of Pediatrics and based at Nkosi Albert Lutuli Hospital. And it's important to remember to say, why do we want to train pediatricians? There's a recognition that worldwide children are dying from preventable diseases like pneumonia, diarrhea, and then prematurity. But the burden of disease can only be addressed if you've got enough health workforce, which are the pediatricians and the subspecialists. So we recognize that worldwide there's a great shortage of pediatricians. The WHO is estimated that we require about 10 specialists, which are pediatricians and subspecialists per 100,000 population to be able to have an adequate health force. But in Africa, we have got less than just 1 pediatrician per 100,000. So if you look at that number, it's just a staggering deficit that you have.
I'm Dr. Beverly Neetling. I am a pediatric hematologist at Nkosi Albert Lutuli Central Hospital in KwaZulu-Natal. I am the current head of pediatric hematology and oncology at Nkosi Albert Lutuli Central Hospital. The burden of disease in terms of pediatric and hematology and oncology is we manage patients with both solid tumors, patients with hematological malignancies, and patients with life-threatening hematological conditions. The solid tumor patients, the main type of patients that we see are patients with brain tumors, patients with nephroblastoma, patients with neuroblastoma, retinoblastoma, osteosarcoma, etc. The hematological malignancy patients, the most common type of malignancy we see are those of patients with B-cell acute lymphoblastic leukemia. And as I said, we also manage patients with life-threatening hematological conditions. And the most common ones are hemophilia patients, patients with aplastic anemia, patients with chronic ITP, sickle cell anemia, thalassemia, etc. The problem in KZN is that there is misdiagnosis and underdiagnosis of our patients, and that means that they present very late to our unit, and this leads to poorer outcomes in our patients. There is thus a need to train more pediatric hematologists and oncologists, specifically for KZN and also for South Africa.
I am Therona Naika. I am a pediatrician working in medical genetics at Nkosi Albert Lutuli Hospital. Here, I provide both inpatient and outpatient services to children born with congenital anomalies. I run the genetics clinics, and here we examine, investigate, and diagnose patients with genetic problems. I recently completed my PhD, which involved understanding the genetic etiology of children with cleft lip and palate. We investigated 100 children with cleft lip and palate and found both known and novel mutations in cleft genes in these patients. This added to the body of knowledge on genetic etiology of clefts in South Africa. I'm very interested in pediatrics and genetics and trying to understand more in this field for both South Africa and Africa.
I am Professor Prakash Monjina from the Department of Pediatrics and Child Health at the University of KwaZulu-Natal. So we've got exciting areas in the Department of Pediatrics in trying to understand the major contributors of child health and child mortality. My latest research is in tuberculosis and biomarkers and looking at transmission dynamics in children. How do children get tuberculosis? This is a global pandemic. There are more than 11 million people getting infected with tuberculosis every year, of which 10% are children. And we know children get TB from adults. So the question that we're trying to answer is, what is this relationship of children and adults in terms of which makes them susceptible to get tuberculosis from a TB-infected adult? So that's an important question. And the second important question that we're answering is, how do we manage, because we have great difficulty in diagnosing tuberculosis in children, could we use biomarkers for diagnosing it as well as looking at response to treatment?
I'm Dr. Stanley Amos Tula, just a retired head of ICU and pulmonology at Albert Luthuli and the University of KwaZulu-Natal. I would recommend our units for further training of people, whether they are from South Africa or somewhere in Africa. We have got about 4 or 5 registered units which can train people in subspecialty. I would really recommend Albert Luthuli and UKZN.
We can change the lives of children in this country. We are at a cutting edge of trying to make science into clinical daily living of little children so that they become the future of South Africa.